Now we want to this kind of be like our first lecture, trying to introduce them properly. That's give the standard definition for acute rheumatic fever. Introduce, give the standard definition for acute rheumatic fever. So so acute rheumatic fever is an autoimmune inflammatory disease. So I should give you guys a gist before. Okay, so is acute rheumatic fever is just coming from the person had a strep throat infection. So the strep throat led into pharyngitis. So the group A Streptococcus was now growing. So as it was growing, it got into the bloodstream. Now as it got into the bloodstream, the body is trying to curtail it, defend itself against the group A Streptococcus. The body is now producing some antibodies, but unfortunately those antibodies can cross-react to some human tissues. They can cross-react to the cardiac myosin, causing inflammation in the heart. They can cross-react with synovial fluid, causing inflammation in the joint. They can cross-react to the basal ganglia, causing sebum and chorea. Do you understand? That's what's the story around this, So it's just a disease that comes from group A Streptococcus, same story. So it primarily affects people that are between age 5 to 15 years, much more commonly, So it's actually a delayed immune response to group A Streptococcal. So it causes strep throat leading to pharyngitis. So typically develops 2 to 3 weeks after the person has had the strep throat or pharyngitis. Okay, that's to tell you that there was a delayed treatment or the treatment was not adequate. So the immune system is trying to defend itself, but unfortunately the immune system gets to react to the host tissues, like I was gisting you guys, because the host tissues have similar antigens to the streptococcus, unfortunately. So this leads to all those inflammation in majorly the heart, okay, the joints, the brain, the skin. Okay, so who is mostly affected? People that are between age 5 to 15, okay, and countries that their economic situation is not really good. Economic situation relates to a lot of things, right? So that's to tell you that citizens are not living well, okay, have higher issues. So it can lead to rheumatic heart disease. It can lead to neurological issue because the antibodies are cross-reacting with the basal ganglia, okay, causing sebum and chorea, and involuntary dance. They call it the Saint Vitus dance. Then you can also be having recurrent acute rheumatic fever, like it's coming and going, okay, over time. So that could actually cause severe damage to your heart over time.